Hello, my name is Sarah Mwangi, and today I'm going to give a speech about nursing theory. Today I'm going to talk about nursing theory and why it's important in the nursing field. When I first heard about the word theory, I honestly thought it was just something you learn in textbook for school. But throughout this course, I started to see that theory actually plays a big role in how nurses think, make decisions, and care for patients. In this presentation, I'll explain how theory impacts nursing as a profession, how it supports nursing as a discipline, and how it contributes to the science of nursing. I'll also talk about how theory can guide research and practice, and then I'll finish by sharing how learning about theory has changed the way I look at patient care. Theory impact on nursing as a profession. Theory helps define what nursing really is as a profession. Nursing isn't just about completing tasks or following instructions from doctors. It also involves understanding patients, building trust, and providing compassionate care. One example is the work of Jim Watson and her theory of human caring. This theory focuses on the importance of caring relationship between nurses and patients. It emphasizes treating patients with respect, showing empathy, and recognizing that patients are more than just their illnesses. These ideas reflect some of the core values of nursing. The values include compassion, respect for dignity, and holistic care. The theory reminds nurses that emotional support and human connection are just as important as physical treatment. Now I'm going to talk about nursing as a discipline. Nursing is also considered a discipline because it has its own body of knowledge and education. Nursing theories help organize that knowledge and give structure to what nurses learn in school and apply in practice. So instead of just memorizing tasks or procedures, theory helps explain why certain approaches are used in patient care. It gives nurses a framework for thinking about health, illness, and patient needs. Because of theory, nursing continues to grow as its own academic field. It helps guide education, research, and professional development within the discipline. Now I'll talk about theory impact on nursing as a science. Theory also plays a role in the scientific side of nursing. Nursing research often uses theories to help guide studies and understand patient outcomes. For example, if researchers are studying how nurse-patient communication affects recovery, they may use theory that focuses on caring relationship or patient-centered care. The theory will help the researchers decide what factors to study and how to interpret their results. This connection between theory and research helps nurses develop evidence-based practices. In other words, theory helps support the science behind nursing care. It helps improve patient outcome over time. To summarize my speech, nursing theory plays an important role in the profession, the discipline, and the science of nursing. It helps define nursing values, organize nursing knowledge, and guide research that improves patient care. Before this course, I didn't really think about how theory is connected to nursing practice. But now I understand that many of the decisions nurses make are influenced by theoretical ideas, even if we don't always realize it. Going forward, learning about theory will help me be more thoughtful in how I approach patient care and how I think about the bigger picture of nursing. I'll be able to provide good and quality care to my patient, basing my care on the theory. Thank you.